Hi, my name is William Cancino, and welcome to my work about radiomic analysis of transvaginal ultrasound cervical images for prediction of preterm birth. Preterm birth, for PTB, is defined as the birth of a baby before 37 weeks of gestation, and unfortunately is the leading cause of death in children under 5 years around the world. Cervical length, measured in the second trimester by transvaginal ultrasound images, is considered the gold standard for PTB risk assessment. However, it is a subjective method, and some studies have reported its low sensitivity. In that sense, this warrants to predict PTB in the first trimester, that is, in the early stages of the pregnancy, in the very early stages of the pregnancy, from the computerized analysis of transvaginal ultrasound images. In the literature, there are two common cervical measurements. The first one is the cervical length, which I mentioned previously, and the second one is the cervical consistency index, or CCI. CCI evaluates the uterine cervix softening, and it's a value between 0 to 1. So CCI uses two measurements. The first one corresponds to the uterine cervix without applying any compression, and the second one corresponds to the uterines at its maximum compression. We propose a workflow that starts from this image, the image that evaluates the cervical consistency index, and this image is split in the middle, and it's pre-processed to remove artifacts and annotations. Then we only use the uncompressed uterine cervix image, and the pixel size is standardized. Then we define, in this image, we define a region of interest. And from this region, we extracted 33 radiomic features using open breast. These features are used to train a candidate neighbor model. And finally, we obtain a risk score for each woman. The performance of 5 biomarkers were evaluated using the area under the curve and its 95% confidence intervals. So cervical consistency index demonstrated a better performance than the cervical length. In the third scenario, that corresponds to our proposed workflow about radiomic features, obtain a better performance than the cervical measurements. When we combine the risk score of the cervical measurements with the risk score of the radiomic features, the last scenario, that is radiomic features plus cervical consistency index, obtain the best performance, the best discrimination ability. We also check the distribution of the risk score for the both groups, normal and preterm birth. And again, the last scenario, radiomic feature plus cervical consistency index, obtain the greatest difference in the medians. So this study highlights the potential of the radiomic analysis for the prediction of preterm birth in the first trimester, providing valuable information beyond traditional biomarkers. To our knowledge, this is the first words that use radiomic analysis in transvaginal ultrasound images for PTB prediction. Thank you, and I hope you enjoyed this presentation.